So atrial fibrillation is a rhythm disorder when your upper and bottom chambers are not beating in a sync. In normal heart, upper and bottom chambers beat in a sync. That sync is disturbed when you go into atrial fibrillation. About 3 million people in this country as of today have atrial fibrillation, and the number is growing. It is estimated by 2030 it will be about 6 to 7 million people who will have atrial fibrillation. The reason for concern is, one, it can affect your health negatively. When you go into atrial fibrillation, you can form blood clots that can cause stroke. Second aspect of this is, when you lose the sync, the heart is not beating in its all 4 cylinders. So people can get short of breath, fatigue, and also once you have these episodes which come and go, they can disturb you emotionally. Some people get depressed. Traditionally, we've been using medications which help people maintain regular rhythm, that is called sinus rhythm. For last 10-12 years, we have moved towards therapy called ablation. So ablation is a procedure which helps maintain and restore regular rhythm. If you look at what causes atrial fibrillation, there are triggers which come from the left side of the heart in the upper chamber called left atrium. Those triggers come from blood vessels called pulmonary veins. When we do ablation, we electrically isolate these pulmonary veins so the triggers don't enter the main chambers, and that prevents atrial fibrillation. So how do we create that scar? And that scar is created by a procedure called ablation. So basically we circle these blood vessels by energy, heat or cold, and that prevents these triggers to come in. When we do ablation, we need energy source. We used to use heat energy, but now you have therapy where we freeze the part of the heart muscle to create a scar. So this is delivered by a device called Artcic-therapy. This was approved by FDA recently. The way it works is we enter the blood vessel in the legs called femoral vein, go into the left side of the heart by making a tiny hole in the septum or partition which is between the right and left. Then we identify the pulmonary veins, and then we put this balloon in which freezes that part of the heart, and that isolates the heart electrically, and that helps us prevent these triggers entering the atrium, and which will cause atrial fibrillation.
Well, I first of all had chest pains. I related it to stress. I attributed it to that. I found out all about it at a stress test, and I've had stress tests before, except that in this particular case, I was very erratic. When I came up, I've had these before, and in the past, I would be very erratic off the top, and then just in a few seconds later, I'd be down, back to normal rhythm. This time I didn't. The doctor who was on call came out there. He says, "Can you feel that? Can you feel that?" And then I identified that I indeed was A-fibbing, and not that my chest pains were related to any kind of stress. So then we began to explore it a little bit further, and then at that time we talked to Dr. Avula and Dr. Dougal. And once we got all that information together, we set a date, and I had the procedure done. So the difference was, after all of the surgery, which I came through pretty good, a month later, after everything, I was just off all of my heart meds. Doctor felt that I was just doing very well. I wore a heart monitor. All that was void of any kind of A-fib whatsoever. And at that time, you know, then I really truly began the benefits of that cryoablation. And by the way, if I said, you know, I'm feeling so good after this, I says, I think I could probably be a pretty good poster boy for cryoablations. And he agreed. He said, and then the second time, you know, second follow-up visit after the surgery, he says, do you mind me I pass your name along? So here I am, giving my testimonial to cryoablation and the effects that it had on me and the way it made me feel.